Dr. D, welcome to Paradigm Health. I know they're very glad to have you on board as medical director. Talk a little bit about how you found your way to Paradigm Health.
Thank you very much for having me. It's a delight to be here. I'm the lucky one, actually. I found my way to Paradigm Health just, I think, because I'm meant to be here. So again, like I said, I'm the lucky one. Um, Paradigm Health found me, or the other way around. Hospice is my calling. Hospice and palliative care is definitely where I'm supposed to be. But I found myself drawn to hospice and palliative care about a decade ago, just because at my core that is who I am, and got trained in it through the practice pathway and got boarded to be sure that I took my training to another
So
level.
you're board certified as physician, but also
Correct.
then extended on to board certification in hospice and palliative care,
That's
correct?
correct. Yes.
And while we're talking about that,
Yes.
describe palliative care for us a little bit and hospice care, and then maybe the
Absolutely.
differences between the two.
Absolutely. So it's very important to know the difference between the two. I'm so really glad that you asked the question. Palliative care and hospice are really two ends of a spectrum. They come together very nicely. Palliative care is the beginning of one end of that spectrum, and hospice is the other end of that spectrum. And both of them are services that we provide for patients that have a terminal or a chronic condition that has no cure. And while it has no cure, we will provide palliative care services. And towards the end of that journey, when their prognosis is terminal, and that is more clearly defined as 6 months or less, that's when they fall into the hospice bucket. So they'll start their journey with us with palliative care, and they could have years chronic care that has no cure, COPD, chronic pain, neurological conditions, even some cancers. And they stay with us for several years. When that condition becomes so terminal, where their physician says, now you have 6 months or less, now they switch over to hospice care. So it's really an entire spectrum, and they come together very nicely. And the fact that Paradigm is so unique that we offer both is such a beautiful thing, and not all hospice care companies do that. And I think that's just a beautiful thing.
And not everyone who goes on palliative care will ultimately be on hospice, correct?
That is a very unique distinction. And so I want patients to know that several patients do, a bulk of our patients will, but you're right, a lot of them may, what I term, graduate palliative care services, and then they flip into home health. And again, we are uniquely positioned that Paradigm provides home health care as well, so they can graduate from palliative care into home health, or they may continue on that spectrum of care into hospice. But also, we have a few unique patients that graduate from hospice into palliative care services as well. And there's a few conditions under which that happens, and they may flip back and forth depending on the team and on the condition itself.
Is it rare for a caregiving company, to have that continuum of care so that they are able, wherever the patient is, to meet them and their needs?
It is rare. I have worked with other hospice companies in the past that have provided only hospice care. There are several home health care companies that provide only home health. It is a very unique situation for a healthcare company to provide the entire continuum from home health to palliative care to hospice, and to have a company such as Paradigm say we will be your partner along the entire journey from beginning to end, and kind of really walk that journey with you, it is unique.